clinical needs finding in domestic settings that challenge students with what we're calling out of context experiences. So as bioengineering educators, we are aware of how potent clinical exposure and needs finding experiences can be for students. Immersing them in diverse healthcare settings as opposed to simply the healthcare settings that surround the university where they're attending can help them cultivate a variety of user environments and mental models that help them to really force them to confront the fact that they're not the user and they're not the client. And this is an area that they frequently jump into. International experiences are preferred by everyone. There's a lot of logistical challenges to this. And for many schools or programs, it's just simply not a possibility that they can have something that takes the students into an international location to experience a different healthcare. So we challenged ourselves to develop an immersive environment that presented similar learning outcomes to a global experience, but was close. So I want to focus a lot of my presentation on this slide here, and I'm going to orient you to it. On the top row, we have what we're calling local, which for us was Houston, global, which as one component of our program, we actually do go to San Jose, which is definitely San Jose, Costa Rica, which is definitely a global location. And then out of context, which I'll unpack in a bit. Now, local Houston patient demographics are diverse. We have both urban and suburban. In Costa Rica, it's a diverse population of urban and rural areas. The epidemiological trends that exist in our local Houston area are lifestyle related. They're not tropical disease or vector-borne of global. And then the innovations and best practices that you see if you're doing clinical observations in Houston might be cutting-edge medical technology with a health infrastructure that's very high income and high resource. Now, San Jose, Costa Rica is a middle-income location with universal health coverage with very strong health outcomes. But it's different than Houston, and it is global. And so there's a new emphasis on sustainable healthcare practices that our students learn. But if we go down to the cost of maintaining or building a program in Costa Rica to give our students this experience is very high, versus in Houston, where the cost might be $100 per student. That's just for background checks or to get a TB test. And the complexity of setting up a global partnership is very high, and the logistical complexity is very high. So what we're advocating or sharing that we did is for what we're calling out of context. So out of context is a healthcare environment which might be neighboring to your own, but has a different patient population. It has a different epidemiological trend, and it has a different health infrastructure. And we're fortunate to be able to go to Rio Grande Valley, which is Brownsville, McAllen, Texas, with a predominantly Hispanic population, high comorbidities, including diabetes, obesity, low SES, lower literacy than average in the United States. And there's a limited access to innovations in this area, and there's a strong drive for community-driven solutions. There's a lot of public health. Adding more technology and adding more medicine is not going to help in this area. It's actually upstream. And that's a lens that the students don't often get the opportunity to see, in contrast to their local environment. Now, the cost to set something like this up for us was relatively low. It was travel down to Rio Grande Valley, and we were able to leverage our existing partnerships with the University of Texas Health Center and other universities. So we would label this as low to medium complexity, as well as the logistical complexity. We don't need visas, we don't need passports, we don't need extra vaccinations. So to conclude this chart, the learning outcomes that you can obtain in a local area are exposure to diverse healthcare systems and patient demographics. You can also understand the regulatory frameworks, which in the United States, in Rio Grande Valley are the FDA, but in global, there's CAHA and other infrastructure. You can also develop some cultural competence, but it is even easier to develop some cultural competence in global and out of context situations. In a global setting, there's also health disparities that you see, but those out of context situations like Rio Grande Valley also have similar global health disparities, and we didn't have to use the United States. So in the Rio Grande Valley, in our out of context, the learning outcomes were navigating healthcare challenges and community-based healthcare solutions while understanding these local disparities. So going back to our initiative, we had a 2-day needs finding experience run for 2 years. Year 1 had 10 students, year 2 had 8. where we observed diverse patient populations. And in year 2, we focused on community health, which included nutritional experts, a visit to a local food market, as well as talking with a local farm. And students were transported out of their comfort zones, and we illustrated a myriad challenge faced by both patients and unique healthcare. In our survey that we administered afterwards, the students reflected a heightened awareness of healthcare diversity, and they strongly recommended for us to continue this type of thing. So due to sharp contrasts in their local location in Rio Grande Valley, we're labeling this type of experience as out of context, and we feel like we're giving them a different lens. And we see similar overlaps in learning outcomes to a global location, but at a fraction of the program costs. Thanks for letting me present this exciting program to you today.